I'm Byerly Ham. I'm one of the nurse practitioners up at the Lookshop, and today we're going to talk about neurotoxins. Here at the Lookshop, we offer Dysport and Botox, which are the common names for neurotoxins. Both are wrinkle relaxers that we use in your forehead, between your eyes, crow's feet, frown lines. We like to have you come in for a consult. The number one question that we get is, how many units am I gonna need? That's very hard to tell until we see you in person. Botox and Dysport used for dynamic muscle movement, meaning anytime you move your face in a certain way or make a certain face, those are the wrinkles that we're targeting with the neurotoxins. Botox and Dysport tend to be our number one treatment for patients here at the Lookshop, and it's a very simple, quick, minimally invasive procedure that we think gives some of the best outcomes for people who have really never had anything done. It's really one of the places that we start with you. Besides some skincare, or in addition to skincare, we can use the Botox and Dysport as well. It takes about 30 minutes. We do a full consult with you. Once we start treating you, we get quicker and quicker. Once we know how your face will respond, how your muscles will respond, make sure that we're not gonna over-treat or have any side effects of the Botox or Dysport, which could be a dropped eyebrow or something like that. We tend to stay very conservative on ours until we know exactly how you are gonna respond. When you come in for a Botox or Dysport appointment, your provider will take your pictures, have you can sign a consent. We will map out a plan for how many units you will need, and we'll go over all of that during your consult. So when you come in for Botox or Dysport, one of the number one questions that we get asked is, how painful is it? Most people would say on a pain scale from 1 to 10, with 10 being the worst pain, that it ranges about a 1 or a 2. Most of the time they are very surprised about how little pain they do have during the treatment. It's quick and easy, so it's not anything that will last long and can be described as just a small pinch. When you have the neuromodulators done, we do recommend that you have your treatment done with every single 90 days. The reason for this is because once your muscles have softened enough, we never want you to get back to baseline to where we have to start all over again. So we have you come back in every 90 days, and our front desk will be happy to schedule that 90-day appointment for you when you leave. We do offer you a 2-week follow-up where we include a couple units for free just for a touch-up. This is complimentary to you and your provider so that you get the best results possible. One of the things about neuromodulators, the Dysport and the Botox, is that when you leave the office, your treatment will not kick in for a 5 to 7 day period. So make sure, number one, that you plan in advance. So if you have an event coming up, we want you to have your Dysport or Botox done at least 2 weeks ahead of time. Ideally, it would be 3 to 4 weeks ahead of your big event. The other thing is when it starts kicking in, you'll notice that one side may kick in faster than the other, which is why we have you wait the full 2 weeks before we do any touch-up treatments. Here at the Lookshop, we do pride ourselves on custom treatments for you. So when you come in for your Botox and Dysport, all of our providers are very good about telling you exactly how many units are gonna get you to the results that you want. We help tailor your services to your specific budget, as well as your specific outcome that you desire. Using Botox and Dysport is probably one of the number one treatments that any of our providers would recommend when you come in and you're ready to get started on your anti-aging, prejuvenation, or rejuvenation journey.